Hi viewers, welcome to my channel. I am Dr. Anwar Hossain. In this video, I will talk about shock. This video includes the definition, types, signs, symptoms, pathophysiology, and total management of different types of shock. So let's start. First of all, the definition of shock. Shock is a systemic state of low tissue perfusion which is inadequate for normal cellular respiration. Now the pathophysiology of shock. You can see here the cellular changes due to shock. This is a flow chart. Tissue perfusion is reduced and that's why cells are deprived of oxygen due to shock. And this situation helps to switch cells from aerobic to anaerobic metabolism, and this results accumulation of lactic acid in the blood. That's why systemic metabolic acidosis occurs. Glucose within the cell is exhausted. Anaerobic respiration ceases. Failure of the sodium-potassium pumps in the cell's membrane and intracellular organelles. Intracellular lysosomes release autodigestive enzymes and cell lysis ensues. Now, the microvascular changes due to shock. Tissue ischemia occurs, and this hypoxia and acidosis activate complement and prime neutrophils. Generation of oxygen free radicals and cytokine release. Injury to the capillary endothelial cells. Further activation of immune and coagulation systems. Damaged endothelium loses its integrity and becomes leaky. Plasma leakage occurs. Tissue edema and exacerbation cellular hypoxia. Now you can see the systemic changes due to shock. First of all, the cardiovascular changes. Decrease of preload and afterload due to shock. Compensatory baroreceptor responses. Increase sympathetic activity. Release of catecholamines into the circulation. Tachycardia and systemic vasoconstriction occur. Now the respiratory changes. Metabolic acidosis occurs due to shock and sympathetic response. Increase respiratory rate and minute ventilation. Increase excretion of carbon dioxide. Now the renal changes. Decrease perfusion pressure in the kidney. Reduced glomerular filtration. Decrease urine output. Activation of renin-angiotensin system. Further vasoconstriction. Increase sodium and water reabsorption by the kidneys. Now the endocrine changes. Decrease preload, vasopressin released from the hypothalamus, vasoconstriction and reabsorption of water in the renal collecting system. Cortisol is released from the adrenal cortex. Sodium and water reabsorption increases. Now you can see clinical feature of shock. This is a list of the clinical picture of different types of shock. You can see here first of all, lactic acidosis. Lactic acidosis in case of compensated shock is less. In case of mild shock is more than compensated shock, and in case of moderate and severe shock it's increasing gradually. And urine output normal in case of compensated shock and mild shock. In case of moderate and severe shock, you can see here urine output is reduced in moderate shock and no urine output, that is anuric, in case of severe shock. Level of consciousness normal, mild anxiety, drowsy and comatose. Respiratory rate normal, increased and levered. Pulse rate mild, increase, increased, increase and increase. Blood pressure normal, mild hypotension, and in case of severe shock, severe hypotension. Now the typical symptoms of shock includes rapid weak pulse due to decreased blood flow, low blood pressure, cold clammy skin, rapid shallow breathing, low urine output, restless, collapse pain. Clinical feature according to amount of blood loss. In case of mild blood loss, that is less than 20% blood loss, cold calm skin, BP is decreased, rapid pulse, collapsed neck pains, and concentrated urine. In case of moderate shock, that is more than 20 to 40% blood loss, feeling of thirsty, hypotension, rapid pulse, oliguria or anuria. In case of severe shock, that is more than 40% blood loss, agitated and confused of the patient, hypotension, tachycardia, rapid pulse, rapid deep respiration. Now the types of shock. The main types of shock include hypovolemic shock caused by too little blood volume, cardiogenic shock due to heart problems, anaphylactic shock caused by allergic reaction, septic shock due to infections, and neurogenic shock caused by damage to the nervous systems. Now, the hypovolemic shock. The most common type is caused by insufficient circulating volume, typically from hemorrhage. For example, RTA or road traffic accident, surgical bleeding, hemoptysis, hematemesis, and etc. Severe vomiting and diarrhea, burn, excessive sweating are also potential causes. Most common types of shock is maxillofacial trauma. Now the hypovolemic shock is classified into hemorrhagic shock and non-hemorrhagic shock. Now hemorrhagic shock. It is due to loss of blood from the body, causing decreased venous return and thus decreasing the cardiac output. Non-hemorrhagic shock. There is massive fluid shift from intravascular compartment to extravascular compartment, causing decreased blood volume and thus decreasing tissue perfusion. It can result from burns, crush injuries, pancreatitis, peritonitis, and pleural effusion, water loss due to severe diarrhea, vomiting, hyperglycemia, and nephritis. Now, the traditional classification of hemorrhagic shock. The degree of hemorrhage can be classified into classes 1 to 4 based on the estimated blood loss required to produce certain physiological compensatory changes. Class 1, less than 50% blood volume lost. Class 2, 50 to 30% blood volume lost. Class 3, 30 to 40% blood volume lost. Class 4, more than 40% blood volume lost. Now the features of different types of shock. First of all, cardiogenic shock. Cardiogenic shock is caused by a failure of the heart to pump correctly, either due to damage to the heart muscles, through myocardial infarction, or through cardiac valve problems, congestive heart failure, ventricular rupture, arrhythmia, pulmonary embolisms are the probable cause of cardiogenic shock. Now the anaphylactic shock. Anaphylactic shock is caused by a severe reaction to an allergen leading to the release of histamine that causes widespread vasodilatation and hypotension. For example, generalized immunoglobulin-mediated hypersensitivity reaction, that is type 1 hypersensitivity. Now, the septic shock. Septic shock is caused by an overwhelming systemic infection that cannot be cleared by immune system, resulting in vasodilatation and hypotension. For example, endotoxic shock, gram-positive septicemia, fungal sepsis, etc. Now, the neurogenic shock. Neurogenic shock arises due to damage to the central nervous system, which impairs cardiac function by reducing heart rate and loosening the blood vessels tone, resulting in severe hypotension. For example, anesthetic accident, spinal injury. Now, the management of different types of shock. Principles of management of shock: assessment of the patient, maintenance of respiration, maintenance of circulation, prevention of renal failure, treatment of underlying causes. Now, the assessment of the patient. Blood pressure measurement should be done. Rate, rhythm and volume of the pulse, respiratory rate and depth should be measured. Measurement of central venous pressure or CVP, urine output, blood gases and electrolyte measurement should be done. Maintenance of respiration. For maintenance of respiration, the following measures should be taken. Posture: raise legs and body supine position. Removal of any tight clothes, airway tube in mouth to prevent fallback of the tongue. Oxygen inhalation, if necessary, endotracheal tube intubation should be done. In this section, you can see some pictures of maintenance of respiration. Here you can see here oxygen is given and the endotracheal tube. Now the maintenance of circulation. Immediate fluid replacement by intravenous fluid administration should be done, and normal saline, IV infusion or 5% DNS, Ranger lactate 2 to 3 liters of 20 to 30 minutes. Initiate blood transfusion after cross-matched, emergency drug administration through IV channel. You can see here some fluid such as normal saline, 5% DNS and Ranger lactates. Maintenance of circulation by blood, fresh frozen plasma. And the prevention of renal failure, keeping urinary output above 50 ml per hour, diuretic should be given if necessary. Treatment of underlying cause, removal of the specific causes. Treatment of hypovolemic shock. Now, the administration of Inotropes such as dopamine, dose 2 to 20 mg per kg per minute IV infusion. Adrenaline 1:1000, dose 0.5 to 1 mg IM. Here we should remember all fluids should be warm before transfusion. Keep the patient warm by covering with blanket. Treatment of cardiogenic shock. Inotropic agent such as dopamine. Dopamine is diluted in normal saline or 5% DNS and given at 5 to 10 microgram per kg per minute. Now the treatment of anaphylactic shock. IV administration of antihistamine such as 1 to 20 mg of chlorpheniramine. IV administration of steroid such as 20 mg of hydrocortisone sodium succinate, and adrenaline 1:1000, 0.5 to 1 milliliter IM. Treatment of septic shock. Broad spectrum parenteral antibiotic. After carrying out blood culture and sensitivity, penicillin or aminoglycoside and metronidazole should be given. Inotropes agent such as dopamine 2 to 20 mg per kg per minute and steroid such as hydrocortisone. Treatment of neurogenic shock. Inotropes agent are given such as epinephrine and antimuscarinic drugs such as atropine. Okay, now the consequence of shock. Number 1, unresuscitable shock. Patients who are in profound shock for a prolonged period of time become unresuscitable. Cell death follows from cellular ischemia. Ability of the body to compensate is lost. Periphery no longer respond appropriately to vasopressor agents. Death is the inevitable result. Number 2, multi-organ failure, that is 2 or more organ systems. Lungs, acute respiratory distress syndrome may be seen. Kidney, acute renal failure occurs. In case of liver, acute liver insufficiency is the result. Clotting system, coagulopathy develops. In cardiac system, cardiovascular failure may be seen. There is no specific treatment for multi-organ failure. Management is by supporting organ systems with ventilation, cardiovascular support, and hemofiltration or dialysis until there is recovery of organ function. It carries a mortality rate of 60%. Thus, ventilation is vital by early aggressive identification and reversal of shock. Thank you for watching the video. I think this video will be helpful for you. If you think this video is helpful for you, please like, put a comment in the comment box and share with your friends.